Today's blog is on shoulder pain. So the shoulder girdle itself comprises three different joints. You have the joint between your clavicle and your shoulder blade, your upper arm and your shoulder blade, and your shoulder blade and your rib cage. Several different muscles cross all of these joints and allow for full movement of the shoulder. You've got your large muscles such as your pectorals and your deltoids, and your smaller stabilising muscles known as the rotator cuff. The rotator cuff are often the source of shoulder pain, which generally comes as a result of dysfunctional movement. This dysfunctional movement places a greater stress on these smaller muscles, which can then lead to a degenerative tendon process which causes pain. This dysfunctional movement doesn't just occur at the shoulder alone. Some of the more recent research is showing that actually an injury in your lower leg can leave you anywhere from 33 to 66% more likely to suffer a shoulder injury. Similarly, 50% of the power produced at the shoulder actually comes from the trunk itself. So, without efficient use of all of our muscles, we aren't correctly getting this transference of force from our trunk to our shoulder. And you can see how this may lead to overstress on smaller stabilizing muscles, which can then cause this degenerative process and pain. Now, the management of the shoulder should not just address the shoulder itself. As I've already said, the dysfunction can come from almost anywhere in the body. You could have an injury to your ankle, which could then lead to a dysfunctional movement up in the shoulder, causing the shoulder pain. If we were to only address the shoulder and only exercise the shoulder, we may provide brief pain and symptom relief, but that's not actually addressing the cause. So what we aim to do is treat not only the source of your pain, which may be the rotator cuff, but also the cause. So we look to find the cause of that dysfunction within either the kinetic chain, that previous injury, anything along those lines, and then once we can address both the source and cause, we can look to permanently resolve your symptoms. If you have any questions about this blog, please post in the comments below.